WHO says COVID-19 increased nearly 30% past 2 weeks. The World Health Organization, WHO, says the global reported cases of COVID-19 have increased by nearly 30% over the past 2 weeks. Dr. Tedros Ghebreyesus, WHO Director General, said this on Wednesday during an online COVID-19 media briefing. Ghebreyesus said that 4 out of 6 of the WHO sub-regions saw cases increasing in the last week. In Europe and America, BA.4 and BA.5 are driving waves. In countries like India, a new sub-lineage of BA.2.75 has also been detected, which we are following, he said. According to him, compounding the challenge are a number of factors. Ghebreyesus said the first was that testing has reduced dramatically in many countries. He said it obscures the true picture of an evolving virus and the real burden of COVID-19 disease globally. The director said it also meant that treatments are not given early enough to prevent serious illness and/or death. Second, new treatments, especially promising new oral antivirals, are still not reaching low and low-middle income countries, depriving whole populations that need them. Third, as the virus evolves, vaccines protection, while still really effective at preventing serious disease and death, does wane. Decreasing immunity underscores the importance of boosters, especially for the most at risk. Fourth, each wave of the virus leaves more people with long COVID or post-COVID conditions, he said. According to Ghebreyesus, it obviously impacts individuals and their families, but it also puts an extra burden on health systems, the wider economy, and society at large. He said the challenges required action at a global, national, and local level. He said that governments, scientists, manufacturers, WHO, and citizens themselves all have their part to play. According to him, essential steps to take include 1. Vaccinate and boost those at most risk. Ghebreyesus said such included older people, people with chronic illnesses, the immunocompromised, and health workers, and then build up the wall of immunity throughout the population. He said the second was to make new oral antivirals and other treatments available to all. The director said that working with Global Fund and UNICEF, WHO developed an allocation mechanism to support countries as antivirals become available. Ghebreyesus said the third was especially if you are in a place where cases are on the rise. Use tried and tested public health measures to mitigate risk. For example, if you are in a crowded place or inside and there's poor ventilation, put on a mask. If you are sick and you can, stay home. The fourth, he said, was crucial to accelerate research and development into next generation vaccines, tests, and treatments. WHO is working with scientists and researchers around the world to make this happen. Through the solidarity trials, WHO can ensure maximum efficiency of clinical trials so that new tools are developed quicker. We don't know how the next variant will be like. This requires that we apply the tools we have now and that we develop the next generation of countermeasures quickly, he said. The WHO boss said the fifth was continue to work to strengthen the global health architecture for health emergency and response at all levels. If you enjoyed this, please like, share and subscribe so you can get notifications.